70-year-old woman has had a fall at home. She has been feeling increasingly dizzy and muddled in the last 2 weeks. She has recently started a new medication. She is frequently rubbing her eyes and licking her lips. Which medication is the most likely cause for her symptoms? A. Amitriptyline. B. Bisoprolol. C. Codeine. D. Digoxin. Or E. Indapamide. Again, I'll give you about 30 seconds to decide your answer. The answer is A. Amitriptyline. This woman is likely to be suffering from the side effects of an anticholinergic drug such as amitriptyline. Side effects include dry eyes, dry mouth, hypotension, which is often postural, and delirium. Amitriptyline is a commonly prescribed neuropathic painkiller. Other side effects include constipation, urinary retention, and arrhythmias. Also hypothermia. So we're now going to discuss the topic of falls. A fall is defined as an event which causes a person to unintentionally rest on the ground or other lower level. There is many causes of falls, and they are often multifactorial. However, specific causes of falls include balance and gait disorders, poor vision, hearing loss, peripheral neuropathy, syncope, orthostatic hypertension, poor mobility, deconditioning, medications, environmental hazards, and hypoglycemia. There is also others. Risk factors for falls can include previous falls, lower limb muscle weakness, vision problems, balance and gait disturbances, polypharmacy, incontinence, older age, a fear of falling, depression, postural hypertension, arthritis, and cognitive impairment. Medications and side effects can commonly cause falls. There is lots of medications that can cause falls, but here's a table with some high-yield examples. For example, benzodiazepines, one example being lorazepam, can cause drowsiness and impaired balance. Sedating antidepressants such as amitriptyline can result in impaired balance and slower reaction times. SSRI antidepressants such as sertraline impair sleep quality, resulting in falls. Loop diuretics such as furosemide cause orthostatic hypertension and hyponatremia. Beta blockers such as bisoprolol can cause bradycardia and hypotension, ultimately resulting in falls. When assessing a fall, start with a focused history. Ask about the mechanism of the fall, associated symptoms such as dizziness, loss of consciousness, and palpitations, and also risk factors like polypharmacy, alcohol, or frailty. It's important to always screen for red flags such as head injury, focal neurology, and prolonged loss of consciousness. Examination should include your vital signs, a neurological and cardiovascular exam, and a gait and balance assessment, commonly used as the timed up and go test. It's also important to look for postural hypertension and injuries like hip fractures. Key investigations include ECG, a lying standing blood pressure, full blood count to see if the patient's anemic, use and ease for dehydration and electrolyte imbalances, glucose, and a medication review. If unexplained, you can consider further workup, such as a CT head for head injury. Management of a fall should be tailored to the cause of the fall. However, generally, patients should be offered a multifactorial risk assessment by an appropriately skilled and experienced clinician, usually in a specialist falls service. This is for older people who present to medical attention because of a fall. Also recommended by NICE is strength and balance training, home hazard assessment and intervention, vision assessment and referral if needed, and a medication review. Complications of falls include fear of falling, social isolation, fractures, and admission to care homes.